Bismillahirrahmanirrahim. The last topic of our lecture is the prenatal diagnosis, which means the diagnosis of fetal congenital anomalies before birth. And the purpose of prenatal diagnosis is to detect fetal anomalies and to provide parents with information regarding informed choice about having a child with an abnormality and to provide reassurance and reduce the anxiety among high risk groups and to provide the information needed for prescribing any prenatal treatment for the fetus. For example, in case of congenital adrenal hyperplasia, the fetus can be given in utero adrenal corticoids to prevent the masculinization of female fetus. And the limitation of prenatal diagnosis is that it cannot be used to rule out all types of possible fetal anomalies, and also it is limited to determine whether the fetus has designated condition indicated by family history or late maternal age or well-defined risk factors. So here in this diagram you can see the different methods of prenatal screening or prenatal diagnosis. The non-invasive ones include the ultrasound and the maternal serum markers, and then the invasive ones which invade through the fetal protective layers are the amniocentesis, where you collect the amniotic fluid sample and cells, and then is the chordocentesis, where you collect the fetal blood through the umbilical cord and umbilical artery, and then there is the chorionic villus sampling, which can be done either from the transabdominal route or from the transcervical route. So to discuss them one by one, the most important non-invasive test is maternal serum marker. It is done between 16 to 18 week of gestation, and there are three serum markers which are done, like alpha fetoprotein and HCG and estriol. AFP or alpha fetoprotein is produced by yolk sac and later by the liver, and in case of neural tube defects like anencephaly, spina bifida, AFP is raised, and in case of Down syndrome, AFP is reduced. And HCG is the single most important maternal serum marker for detection of Down syndrome. And in case of Down syndrome, human chorionic gonadotropin levels are elevated. So the combined use of three maternal serum markers, including reduced AFP, reduced conjugated estriol, and increased HCG, can detect around 60% of the Down syndrome pregnancies. And then comes the ultrasound for fetal anomalies, which is also known as fetal anomaly scan. It is done at 16th to 18th week of gestation, and it makes possible the antenatal diagnosis of hydrocephalus, spina bifida, structural defects of the face, and congenital heart defects, congenital diaphragmatic hernia, and disorders of GIT and skeletal anomalies. And then there is a four-chamber view of the fetal heart by detailed fetal echocardiography, which improves the detection of cardiac anomalies. And the knuckle translucency. What is the knuckle translucency? It is a collection of fluid under the skin behind the fetal neck. In case of Down syndrome and other chromosomal defects like Tau and Edwards syndrome, the knuckle translucency is increased. And now the invasive tests, they include the amniocentesis, which is done between 15 to 20 weeks of pregnancy. Before 15 weeks, there is high risk of complication, so it is not done before 15th week. And it is ultrasound guided, and we collect the amniotic fluid and cells shed by the fetus, and the status of the fetus can be checked by 16th to 17th week of pregnancy. For chromosomal analysis, the fetal cells which we collected are cultured, and the result of the test is available in 10 to 14 days. And indications include in high risk women more than 35 years of age with increased risk for Down syndrome, and when the parents have another child with chromosomal anomaly, or one of the parent is a known carrier of inherited disease. And then comes the chorionic villus sampling. It is again an invasive procedure where there is high risk of complications like limb loss. So it cannot be done before 10th week, and it is done after 10th week of pregnancy, and transabdominal approach is more common. It is used for fetal chromosomal studies, DNA analysis, and biochemical studies. And the fetal tissue does not need to be cultured, and the fetal chromosomal analysis is available in 24 hours because there is no need for culture, and the DNA analysis and biochemical tests are completed in 1 to 2 weeks. And then is the chordocentesis or percutaneous fetal cord blood sampling. There is high risk of pregnancy loss, so it is reserved for only those conditions in which rapid cytogenetic analysis is needed, and the information cannot be obtained by any other type of test. It is done after 16 weeks of pregnancy, and indications include the risk of hemoglobinopathies, coagulation disorders, metabolic and cytogenetic disorders, and immune deficiencies. Also, the risk of fetal infections such as rubella and toxoplasmosis. So, the measurement of IgM antibodies or direct blood cultures of the fetal cord blood is done. So, in case of cytogenetic studies from fetal cord blood, the result is obtained within 48 to 72 hours. Now, what type of cytogenetic and biochemical analysis are done from all these samples of amniotic fluid or from chorionic villus sampling or from the fetal cord blood? The biochemical analysis include the level of alpha fetoprotein and certain other abnormal biochemical products in maternal blood and in amniotic fluid and fetal blood. And the cytogenetic studies are done to find out the karyotype, to detect numerical chromosomal anomalies, and to detect the gender or sex of the fetus. And the DNA analysis is done to detect enzymatic disorders and inborn errors of metabolism such as Tay-Sachs disease, glycogen storage disorder, and familial hypercholesterolemia. At the moment, the prenatal diagnosis for more than 70 inborn errors of metabolism is available. So that's all for today, and at the end of the day, the goals are simple: safety and security. Stay homes, study distant, and stay safe. Thank you so much.